The number of people in therapy is on the rise. In fact, according to Statista, about 60 million U.S. adults received mental health treatment or counseling last year, which is up from just 40 million in 2019.
But there are many different forms of therapy out there. So how do you figure out which one is right for you? Robi Ludwig joins us now to walk us through some of the most common methods. She's a psychotherapist and host of the Pivot with Robi Ludwig podcast. Robi, always good to see you.
Good to see you.
I think this is an important conversation to have because sometimes people want to start that therapy journey. They don't know where to begin. So one of the most common ones we hear about, cognitive behavior therapy. What is that?
Yes. So that is a therapy that addresses some of your distorted thoughts. And it helps you look at the thoughts that you have and how it may be contributing to depression, anxiety, and question those thoughts. So in doing that, you realize some of the noise in your head and you're not as susceptible. It's also good for people who like homework and to try certain tools when in between sessions. It's highly effective.
I love that.
CBT.
I love the idea of like self-investigating and self-reflecting. But I know that there are therapies that aren't just about talking, that are also about your physical response. Someone told me there's one that follows your eye movement.
So that's EMDR, and that is really useful for people who have trauma, PTSD, and the way it works is it helps the right hemisphere of the brain interact with the left hemisphere. And so it's tapping or using eye movement when you talk about something that's traumatic. And the idea behind this is that your memories get filed away in a proper place where it's less disruptive, which it can't do on its own.
Wait, what do you mean tapping?
So sometimes a tapping noise, or you have eye movement and talk about the trauma that you've had, and it helps to file it away. And sometimes people will do this after talk therapy, may not be getting to the deeper issues that are causing the trauma or PTSD.
Really That's a real mind-body connection. And speaking of body, another form of therapy that really is focused on that is somatic therapy. What is that?
Right. So sometimes we have aches and pains and things going on in the body, and once you've ruled out that it's not a medical condition, you can start to understand how these body ailments may be connected to your emotions, and it uses body movements along with the talking therapy. So certain postures, certain breathing, certain physical stances sometimes is very helpful in terms of connecting a person to their body so they understand what's going on better.
But if you're someone who's like new to therapy or never done therapy, like where can you go to know which type of these things is actually available to you or would suit you? I mean, I assume that every sort of therapist isn't created equal in their knowledge of these
First of all, you should use your intuition and decide who you feel comfortable with. That's a big one, and that they're licensed. And some people want more talk therapy. So that would be cognitive behavioral, that would be the IFS, which deals with the different aspects of who you are. And it's talking, the talking cure, as they say, that really helps you to do better. For those who are dealing with deep trauma, you know, the EMDR is good. It's not as much talking and highly effective. And with the somatic therapy, same thing. Sometimes people don't connect via words. And so identify what fits best and move in that direction.
This was a masterclass for us.
It really was. Robi Ludwig, as always, thank you for joining us and sharing your expertise.
Thank you, Robi. And keep it right here, folks. You are watching NBC News Daily.